We are in IFSO collecting interesting conversation about this important congress. Now, for me, it's a pleasure to introduce you my next interview. He's from Chile, but we are going to talk in English. So, Dr. Camilo Boza, Congress President, IFSO 2025, also a surgeon at Las Condes Clínica Las Condes. Nice to talk to you.
Thank you very much, Macarena.
Could you explain us how important is IFSO?
Well, IFSO is a federation that collects all of the countries performing surgery for obesity. But now, actually, in this conference, on the presidential session, it was announced that this federation has changed the name for International Federation for the Surgery of Obesity and Other Therapies. So that means that this federation is bringing together all the options of treatment for obesity. We understood that obesity is not one disease. It's not that you are a surgeon and do surgery, or you do medications, or you do endoscopy, or you perform any other procedures that really affects the evolution of this disease.
Let's talk about obesity, but first I want to know what makes the 2025 editions especially important.
Well, first of all, because it was in Chile. First time
and we're Chilean.
A World Congress is done in Latin America, especially in Chile in the last 10, 20 years. So that's very important to us. But at this point of the evolution of the disease, obesity, this Congress has been a particularly, that's why we put the name of the dawn of a new era, because everything changed. Because before, there were no medication affecting obesity, but now we have injections, we have drugs, we have medication that really impacts in the evolution of the disease. Also, there's many new technologies, magnets, endoscopy, and surgery. And what we believe, and that's why the change of the name of the society, is that a society that really brings together all these options is the best way to treat the disease.
You worked at Clínica Las Condes. That clinic play a role in this Congress?
Well, I work at Clínica Las Condes, and they help us very much because we did live surgery from there. All the pre-Congress courses were done there. So we had a very good relation, and we are doing very nice things there. New technologies such as the magnets, so we are very happy of that collaboration.
I'm going to ask you about you as a doctor. As a doctor, what did you learn in this Congress? What was new for you?
Well, for me, the new thing is that we understood, we surgeons, as a surgical community, that we need to embrace all the options for treatment. We need to embrace surgery because we are surgeons, but surgeons now need to understand how to prescribe medication. Surgeons need to learn endoscopy. Surgeons need to understand the role of the multidisciplinary team, the role of psychology, the role of exercise, the role of nutrition, the role of proteins, the role, we need to really be the managers of all the options to give the best treatments for our patients.
Yeah, that's very important because it's not one treatment or other treatment. They are all together. So it's not the drugs are not going to kill the surgery?
Definitely not. This Congress, I was a bit stressed before the beginning of this Congress.
Because you're a surgeon.
Yeah, because I'm a surgeon and because the rise of medication, now 6% of all population in the US is having prescriptions for obesity medication. So we thought, oh, surgery is going to disappear, but no, we understood.
Not going to disappear.
No, because medication, if it's done not in a multidisciplinary way, it usually doesn't work. So that's why we need to understand that obesity is a chronic disease and it has multiple treatments, and probably working in a synergic way with medication, with endoscopy, with surgery, we're going to achieve the best results for the treatment of the disease.
Let's talk about obesity. I learned in this Congress too, I learned that obesity is a chronic disease. We have to treat like that. So what is the obesity and how is the situation here in Chile and around the world?
Well, I think Chile has done quite a great job in understanding that obesity is a chronic disease.
It's a chronic disease.
However, we still face a lot of stigma. Stigma in
That is the word part.
society, stigma in the healthcare professionals. Even colleagues, doctors are, many times a patient comes here with this disease and says, oh, this is basically because you are not exercising, because you are not eating well. Habits are relevant, but it's a disease. And when the disease is on, we have to treat the disease. We have to work on prevention, and that's important.
That's important.
But when the disease is established, we need to start treating options, and we need to assess what is good, what is bad, what is the best combination. And that's why now, for the next months and next years, we'll start speaking about combination therapy, combining medication with surgery, medication with endoscopy, endoscopy with surgery, and all of the options.
And you have a lot of options, surgery and drugs, but you have to change your mind, your style life. What do you think about that?
Well,
did you talk about that?
Yeah. We had really interesting. Actually, we have a Chilean comedian that is very famous, Pamela Leiva.
Yes.
And she presented her book in our session, where at the Chile Day, that we have a special day for the Chilean society, and she basically gave this book as a gift to our society, telling her story of discrimination, stigma, and then understanding that there was an option that was surgery, having surgery, changing her life thanks to surgery, but then understanding that surgery was one instrument, that she had to embrace the other support areas for the surgery. She had to understand that maybe she would need medication, that she had to work a lot on exercise, diet, the use of proteins, the treatment of anxiety, and many other things that you need to have better results.
I don't have much time, but what is your main message and what is the future of the IFSO?
Well, we are very happy. I must say that we were worried on how all this year has been that the medications had gone rising very much. Surgery was falling down in terms of numbers, but now we feel much more confident that numbers are going to maintain, that we are probably the gatekeepers of the best treatments. Because probably if we continue to stay in our corner, oh no, I do surgery, no, I only do medication, that's a lost battle. We need to work together, we felt in this Congress that the vibe of collaborating between endocrinologists, obesity medicine doctors, surgeons, endoscopists, etc., would be fantastic. Now, 10 minutes ago, we had the finals of the triathlon. We had surgeons performing endoscopy, laparoscopy, and robotics at the same time, competing in themselves as a joke, but making who was more having the best dexterity to perform the surgeries. But basically the message was that we need to be able to offer all of the options, all of the treatments to our patients.
We have to work together. Doctors, patients, nutrition, dietitians, school, public, private, all together, because we are facing a very, very big pandemic.
Actually, we had a session on stigma. We had a special session on patient experience. We had Chilean patients that went to a session and they had all their experience. We had sessions on exercise, sessions on nutrition. So we are really covering all of the aspects of the treatment of this disease.
Dr. Camilo Boza, thank you for this conversation. It was
thank
a pleasure to talk to you.
Macarena. Thank you.
I thank you and see you in another interesting conversation.